Hi, I'm Justin Wilkes. I'm one of the 19 Carver College of Medicine students that decided to do the full year in Des Moines. Dr. Craig asked me to talk a little bit about the psychiatry rotation. So it's organized like this. It's split in half. So the first 2 weeks, or the second 2 weeks, you'll do a inpatient rotation at the VA with Dr. Iqbal. There will be a 1 week where you're on consult team at Iowa Methodist, and then 1 week where you're on child psych with one of the psychiatrists around Des Moines. The daily schedule kind of works like this. So the VA with Dr. Iqbal, you'll go in and pre-round on some of the patients, and then you'll round on all the patients with Dr. Iqbal, and sometimes there's another DMU student there. In the afternoon, you kind of get some more time to read and kind of learn about the things you talked about in the morning, and then we go in and see the patients some more. As far as consult team goes, basically just come in the morning, and I was with Dr. Robinson, and we would go see any patients that he got calls about earlier that week or that day. So that would be kind of done by noon, and he does a lot of teaching during that time. We go through all the meds and all the diagnoses of the patient. So he's a really good internal med teacher, and as most of the consult doctors are, I think. And then in the afternoon, he'd kind of send me to the library, and I think that's what most of the consult doctors do, and just give me a call whenever we had an active consult to go see. And then the last part of the rotation, the child psych rotation, it's a little bit different depending on which doctor you work with. I was with Dr. Kunze. He does a lot of different things around Des Moines. We went to a couple of homes where kids stay permanently because of problems they've had at home. We went to a home for autistic kids, and then we spent some time in his clinic seeing kids that come in just as an outpatient basis. The biggest strengths that I thought with this rotation in Des Moines, we got a lot of independence as far as there's a lot of free time where you could choose to study or kind of apply what you learn and go see the patients yourself. Another strength is that all three doctors that I worked with were really good teachers and excited about teaching. And as far as Des Moines goes, you get a lot of variety by being on the different teams and how it's split up like that, as opposed to being on one team for the whole time. So I really enjoyed my time in Des Moines on this rotation, and if you want to talk to anybody about it, you can contact Dr. Craig or Wendy.